Hello, and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. For those that don't know me, I am Dr. Latoya Wells, doctor of nursing practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. We are a full service family practice and wellness clinic servicing all of your healthcare and wellness needs. We're located at 452 Osceola Street, Altamont Springs, Florida. Our number is 321-306-6755. And you can also find us on the web at wellslegacyhealthandwellness.com or wellslegacyhealth.com. You can also find us on all of the social media platforms. If you have not gone to our YouTube page, we do have YouTube where you can catch all of our lives on demand on YouTube. We may have some surprises on our YouTube page as well. So go over and like and share our YouTube page, subscribe and share and like all of the good things to our YouTube page, Wells Legacy Health and Wellness. We're here for another episode, and this week we're closing out Breast Cancer Awareness Month. And I have another one of my amazing shirts, Divas for the Cause, that I wanted to share. A group of women that I hold so dear to my heart. We created this group and we created this cause. Well, we didn't create the cause, but we band together, we join together each year to support breast cancer awareness. And the amazing thing about this is that we have 3 breast cancer survivors in our group. And I'm just so grateful for them. And I'm so grateful for their journey and seeing them on the other side of breast cancer. I have had the opportunity to be there with each one of them through that journey, and it's something else, and it just shows their strength and their resilience. So as we close out October, which is the month that we celebrate breast cancer, it doesn't mean that we stop talking about it, that we stop getting screened, that we stop supporting our men and women and women and those men who are impacted by breast cancer. We don't stop encouraging our friends, our family, our sisters, our aunts, our uncles to have discussions with their significant others and their family members and their friends. Even though there's a month set aside, this disease is impacting lives daily. So much so that we've talked about statistics in the past, and we're going to kind of brush over it a little bit tonight. But tonight we're going to focus on life with breast cancer and life after a diagnosis and you've been, in remission and no longer have any cancer in your body, things that you can do and things that we can do to support those who have gone through this journey. So statistically speaking, 1 in 8 women in the United States will develop invasive breast cancer in their lifetime. And each year, more than 280,000 cases are diagnosed among women. And as we talked about last weekend in several other sessions or episodes, there are men who also are diagnosed with breast cancer. There's some statistics around that. And each year in the United States, about 2,500 men are diagnosed with breast cancer. So it's so important, one, as I like to drive home, that we get those annual exams, that we get the physical exams, that we know our bodies, that we're paying attention to any changes that may occur. Early detection is so important, so much so that there is a 5-year survival rate that is about 90% or above when we find cancer early, right? So if it's caught early enough, there's a 5-year, 90% chance of a 5-year survival rate of the cancer. So we talked about the risk factors of breast cancer, but I want to highlight those again tonight. Family history, your age, genetics, lifestyle. So knowing your risk factors and knowing your family history are some of the things that can help empower you, right? And help you be armed with knowledge. And as I mentioned a lot, I love to make sure that my patients, family, community, our mission, that you guys have what you need to be able to advocate for yourself and make the best choices when it comes to your healthcare. And so with that being said, knowing your family history, knowing the genetic component, knowing any risk factors that you may have is so important. And in terms of getting screened early based on your risk factors. So what do we do in terms of individuals who are navigating a breast cancer diagnosis? Having a front row seat to not just the three individuals that I mentioned here, but family members and several other friends who have been diagnosed with breast cancer, and patients as well that I've taken care of who've been diagnosed with breast cancer. There is a lot of emotional impact and a lot of emotions involved. So much so in terms of fear and uncertainty, grief are very common. So grief of the life that they once had, fear of not knowing what's going to happen or the outcome. And I've never been diagnosed with breast cancer. My grandmother was, and I do have some family members who were, but doing my self breast exam, as we've talked about, and the importance of doing that, I did find a lump. And the instant fear that came when I found that lump, and the disbelief, and like, okay, is this real? There's a myriad of emotions that are felt by women and men who are diagnosed with breast cancer, and the uncertainty of what's going to happen. Finding that initial lump, having that mammogram that is abnormal, noticing the changes in the breast, or an incidental finding on some other type of test, and you're told that you have breast cancer. That's a lot for someone to take in. And being there, walking through this with several individuals, it's overwhelming. It can definitely be overwhelming. And then the grief of the life that they once had and the life that they once were able to live, and grief of quote unquote a good health status or overall good health. And now you've never been sick a day in your life and never had any issues, and all of a sudden you receive a breast cancer diagnosis. But I'm here to tell you today that there is life after breast cancer diagnosis, right? It's not the end all be all. When you receive a breast cancer diagnosis, many different journeys and pathways for each individual who's diagnosed. So one person's journey will look completely different for someone else's. And so when we talk about it, there's a thing called scan anxiety. It's before the screening and the checkups, just the anxiety of not knowing. And I've heard this countless of times from many women. I don't want to get screened because I'd rather not know. Because if I know, then all the things that come with that, all of the emotions that come with that. And so there's something called scan anxiety, where these individuals get anxiety before they even have the screening or they have the checkup. And these feelings are valid, very valid. And so I want to validate that. And addressing them early are so important, and it's powerful in terms of managing the journey, right? So if you find the lump, I'll use myself. I found a lump in my left breast first. And I think I shared a little bit of that story last week, where I was in between jobs and did not have insurance at the moment, was waiting for my new insurance to pick up. And the fear and anxiety that I felt in that moment while I was waiting for the mammogram, while I was waiting to get in to see the specialist, and it was very overwhelming. Support is so important for individuals that are going through, and support can look different. Support could be someone being there, counseling. It could be family, friends. It could be professional counseling or therapy. It can be support groups, being surrounded by other women who are going through the same thing or who have gone through what you've been through. Online communities. We know during the COVID era or COVID times, which was still in COVID, right? A lot of things went online. And so individuals don't even have to step out of their house, the comfort of their homes, in order to get the support that they need. But just making sure that they're surrounded by supportive, caring individuals who are offering understanding, who are offering a safe space, who are offering a shoulder to cry on, who are offering ears to listen, even if it's just silence, right? Who are sending the text messages, who are getting the meal trains together, sending out the meals to individuals who may need it, who are providing the rides to therapy, who just shows up at therapy and just sits, who's there in the waiting room when they're getting the mammograms or getting the ultrasounds or the biopsies. Family, friends who are there during the surgeries and, taking to and from and just being there. Support is so important and so instrumental in the overall outcome for many of the women and men who develop breast cancer. So when we talk about different treatments, there's surgery, right? Many individuals who have breast cancer will undergo surgery, whether it be a lumpectomy or it be to remove the tumor, or it may be just a small amount of tissue, or a radical mastectomy where they're removing all of the breast tissue and lymph nodes, or one breast versus both breasts. Surgery can look different. And with that also comes the option of reconstruction. So if an individual, a woman has a bilateral mastectomy, all the breast tissue is removed, they have the option of having a reconstructive surgery done and many surgeons do it differently. Most recently, the journey that I was able to be a part of, there were expanders put in where they go in and prepare the tissue and the chest cavity for the implants. And so the expanders are almost like balloons where they put them in there, and it allows the tissue around to adjust and adapt to this foreign body in its sense, within the body. And they go in and inject saline to slowly increase the mass or the size of the expanders to the desired size that the woman would want in terms of cc's. Once those expanders are in and the body has been prepped, that individual will then go into surgery and have the implants placed. So surgery is one. Another option, in terms of some women opt not to have the implants. They just want the breast completely removed, whether it be one or both, and they don't want reconstructive surgery. But for those who do, that is an option. And for those who don't, that's an option as well. As I mentioned, everybody's journey, each individual person's journey is just that. It's specific to them. It's special to them. It's individualized to that person and will look different from someone else. Radiation and chemotherapy, these are treatment options for surgery for cancer. And what it does, it's needed before and after, right, to kill the remaining cancer cells. So individual may have chemotherapy and at the same time they're undergoing radiation. Some women will only receive chemotherapy and no radiation. Some will receive just radiation and no chemotherapy. It just depends on the type of cancer, the stage of the cancer, where it's located, and if there's a solid tumor or not. And depending on, again, what type of surgery will determine the treatment plan. So that's why it's so important to get the screening early. And if there is found to be a cancer or a tumor, getting in with the healthcare specialist, oncologist, surgical oncologist, what have you. There's a team of individuals that are involved in the care of this patient who has been diagnosed with breast cancer. And when they say it takes a village, it takes a village. There's a village of healthcare providers who are working with these patients. There's a health navigator. There's someone that's getting all the appointments set up. There's a surgical scheduler. You have the surgical oncologist. You have the oncologist and, the radiation therapist, and so many different individuals that are involved. And that's why it's so important to have support, because getting the diagnosis initially can be a lot, but then sitting and listening to the treatment plan, and this is what we need to do, and you got to have these appointments, and you're going to do this, and you're going to do that, can be overwhelming. And so I had the privilege of being there as support, and I was so grateful to be allowed to be there. So we talked about radiation, chemotherapy, and surgery. There's also hormone replacement therapy and targeted treatment. And these therapies work to block the hormones or proteins that that grow the cancer cells. And so it's offering an additional way to reduce and prevent recurrence of the cells. So after a woman has either gone through chemotherapy, and so what I've seen recently is the individual went through chemotherapy, had some chemotherapy in the beginning. They then went and had the mastectomy, continued chemotherapy. There was no radiation, and then was placed on the hormone therapy, and then had the mastectomy, had the reconstructive, and will continue on with the hormone therapy. So recovery in life after breast cancer. So there's one, physical recovery. We've talked about the surgeries that may have happened or have needed to be happened. And so this individual will have to recover from those surgeries. So post-surgery usually takes, that healing takes sometimes months. Physical therapy, depending on if there was any additional involvement or surgeries that impacted range of motion, potential adjustments due to appearance and in terms of sensation. And then physical scarring, it may fade, but may change over, the lifetime of that individual's lifetime. So you may see a scar. They may provide some cream, or I've seen use silicone gel to help reduce the scarring and discoloration within the skin. Managing the side effects. Oh, let me go back. We got the physical healing and recovery, but there's also mental and emotional healing and recovery. So making sure that the support is still there, that the therapy is still continuing, and that the services and resources are still available for these individuals. Managing the side effects. So long-term side effects from chemotherapy include fatigue, neuropathy, memory issues, which is considered to be or called chemo brain, can persist and can be, happen and occur for this individual for months, even years. And there's different things that can be done to help with that. And so again, everybody's treatment and their recovery is going to look different. So definitely managing these signs and symptoms can be challenging, but there are treatment regimens that are available, and having that support and follow up with their healthcare providers is important to help with that. Lifestyle adjustment. So many survivors will focus on healthy diets, regular exercise, stress reducing, things that they can do to reduce stress. And then just making sure that they have positivity around them is so important. Many individuals will, look at life differently. I had a conversation with someone that underwent chemotherapy and went through the breast cancer diagnosis, treatment, and post-recovery. And she said to me, I don't sweat the small stuff anymore. This individual said, I was one who everything had to be in place. Everything had to be planned out. I would get upset if it didn't happen. She said, I don't have control over anything. And so I don't sweat the small things. I don't sweat the small stuff because it doesn't matter in the grand scheme of things. I just kind of go with life in general, just go with the flow. So we talked about the different surgeries. We talked about living with cancer and some of the adjustments that need to be made and can be made. Follow-up care. So again, continuing those screenings, mammograms, MRIs, blood testing, depending on your journey or that person's journey, their follow-up care is going to look different. But these are just some of the routine or scheduled things that may happen. Continue monitoring the symptoms. So as we mentioned, the fatigue, the neuropathy, and with neuropathy is numbness and tingling, either in the hands or feet or lower extremities. And that could be because of nerve damage from chemotherapy. Many patients who receive chemotherapy will experience this or may experience neuropathy. And so there's different treatments and medications and things that can be done. So monitoring the symptoms, mental health check-ins, and then making sure you're building a good support system. A really good support system is vital. It's so vital to make sure that this individual has what they need after surgery, after chemotherapy is done, and years later, because they're going to have to continue with some medications and they may still have side effects. Loved ones and friends play such a major role in providing comfort. again, the check-ins and, being there to help, running the errands, doing, participating in whatever way we're needed. I mentioned the support groups, so joining the support groups and the ongoing integration of oneself into other individuals' lives, the health groups and things of that nature, support or survivors group or what have you. There's so many different resources and support groups that are available that can definitely help. And then professional help. So continuing with the therapy and the counseling, particularly those who specialize in cancer care, who can help individuals navigate the emotional toll that this can take on a person. I remember I had a friend I have a friend who is always very upbeat. And even throughout her cancer journey, dealing with the diagnosis, the treatment, the surgery, and after, she remained so positive. And there was one day where she was just like, I can't do it anymore. She was putting on a safe face and a brave face for her husband and her kids because she didn't want them to know that she was sad, know that she was grieving, or that she was in pain, or that she was overwhelmed. And we had to have a conversation that, listen, you have to feel what you're feeling and you have to be able to express that and know that you have a safe space to do so. And we had that conversation and she was able to express her feelings, her husband was like, oh my gosh, I'm so happy that she's expressing this to me, because I was concerned. He was so concerned about her that, not that she was happy, but that he felt that she was withholding, that she was holding back on really expressing how she was feeling and how she was navigating the diagnosis and the whole journey. And so once she was able to get to that point through therapy and, talking with her family and talking with her kids, she was able to just kind of relax a little bit. So some resources, we talked about this previously. We have the American Cancer Society. It's the leading organization offering educational resources, support programs, financial aid, and access to patient navigators who can help women navigate this journey of breast cancer, women and men. There was last Saturday a American Cancer Society walk that was held all over, but there was one here in the Central Florida area. And there were, I believe they were saying up to 30 to 40,000 individuals who walked, who donated monies and funds to help fund breast cancer research. And it was just amazing. I wasn't able to be a part of it because I fractured my foot. So I had to kind of sit out on the sidelines and just cheer from my house, cheer my friends and colleagues and others on who were participating in the walk. There's a National Breast Cancer Foundation, which provides comprehensive patient support, again, educational materials, access to screening, and then financial assistance. There's also a lot of local organizations that pull together to help provide free or low-cost mammograms. So look into your local area. You have the Living Beyond Breast Cancer service, which is a resource for survivors of breast cancer, providing community support and information on treatment and recovery. We also have the Susan G. Komen Foundation, which provides, again, more funding for research and community-based breast health programs. I can remember when I found the lump in my breast, the hospital that I work with had a partnership with the Susan G. Komen Foundation. And that's where I was able to go and get funding and get assistance and a navigator to help me get my mammogram because my insurance had not kicked in yet. And once my insurance kicked in, then insurance kind of took over. Thriving beyond cancer. So things that you can do as individuals is living a fulfilling life after cancer as possible. Travel, take the trip, go on a girls trip, take up the hobby, do the things that you enjoy doing, because tomorrow isn't promised for anybody, not just individuals who have breast cancer, but we don't know what tomorrow holds. We don't know what the future holds. So I encourage those that I know and patients that I've taken care of from a primary care standpoint who were or are breast cancer patients. Do all of the things that you've enjoyed doing and make sure that you're enjoying yourself. So giving back, volunteering. At the race this past weekend, there were so many survivors, so many women who were actively going through breast cancer treatment, women who had just been diagnosed with breast cancer, who were there supporting others while they were going through their own journey. It was amazing. And it brought me to tears while I was watching the news coverage of it. And I was just like, the strength of these women and the men that are there. It was just amazing. Celebrating life, as I mentioned, finding the hobbies, reconnecting with your passions, taking on new adventures. Survivors often say that they lived with renewed sense of purpose. And I've seen that. Like my friend, don't sweat the small things. Enjoy life. Take every day as a gift because that's what it is. Setting personal goals. So if it's getting healthy, if it's working out, things of that nature. I'm a part of a workout group through Peloton. It's Black Girl Magic Peloton. And to see some of the women who receive breast cancer diagnoses and allow us to be a part of that journey and to watch them pre-diagnosis, they get the diagnoses, they're still working out, they're still doing the things, whether it may be yoga or just, stretching or taking walks or some of the meditations, but still remaining active and doing things that bring them joy while they're on that journey. And then to see them come back and slowly increase their exercise and slowly increase their activity and involvement, because that's some of the things that bring them joy. Spending quality time with the ones that you love. I remember having met this lady who held a really high position at the company that I worked for at the time and was diagnosed with breast cancer. And she said, it's not worth it. I've given so much to this job, which she loved. But she says, my health and my family come first. And she made the decision, which was a tough decision for her, but she made the decision to step down. And she just went to working part-time. Not many individuals can afford that. Not many individuals have that option. But for those who do, it's important to just recalibrate some things. And if that's what it takes for you to feel like you're living your life to the best of your ability and you're spending your time in the way that matters most, then do what works for you. I just want to say this has been an amazing journey amazing journey for many women. And it's a tough journey. It's hard. I can remember listening to news coverage this past Saturday, and there was a woman, and it just broke my heart. They asked her, she was a survivor, and they asked her, how was that journey? She said, it was hard. It was tough. It took a lot from me, but I have so much more now and a different perspective now after the fact. And I'm getting a little emotional because I'm thinking about all of the women and men who've lost their lives to breast cancer. Every day on social media, I'm connected to so many different people. I'm seeing the stories of young women dying of breast cancer, leaving behind their babies and their husbands. And it's a lot. So we have to, and I'm thinking about my aunt and, some close friends who have made such an impact on the community who are no longer here because of breast cancer. Get screened early. Make sure you're paying attention to your bodies. Encourage your girlfriends to get screened. Encourage your family members to get screened. We want to do what we can do to save and preserve life. I know that it could be scary. I know there's the fear of the unknown. I know there's anxiety and all of that comes with this. But taking the first steps to get screened and follow up as prescribed can save your life. Do what you need to do to make sure that you're healthy and that your loved ones are healthy. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Until next time, stay safe and be well. Have an amazing Wednesday, and we will see you later. Bye.